Okay, so Dr. Masikori has looked at the logistical part of it. I want us to speak to Dr. Julius Oyugi, who's a virologist and microbiologist as well, just to try and answer some of the questions that are on your mind. Dr. Thank you for joining us on Checkpoint this evening. So the first batch is coming with about 1.2 million doses. And the question is, who gets to get this first? I know the CS has alluded to priority groups from where you sit. Who is in this priority group?
Thank you, Linda. First of all, I have to congratulate the government of Kenya for bringing the COVID-19 vaccine to this country. Remember, we are in a pandemic, and the virus has been spreading across this country. Although we have not been seeing a lot of deaths, but still the virus is around. In terms of the people who are supposed to be prioritized when this vaccine arrives here, number one, we have the healthcare workers. Those are key people to be prioritized for giving the vaccines. Then teachers are important. Then the security forces like the police are important. People with the comorbidities, hypertension, diabetes are also important. And then people working in the hotel industry. Those people should also be considered for this vaccine.
There's a concern that, you see now, in the minds of Kenyans, once the vaccine gets here, we have 1.2, we are over 50 million Kenyans. There's a concern that there may be people who will let down their guard in terms of COVID-19 protocols. How important is it that Kenyans still observe these protocols, even as we wait for everyone else to be vaccinated? Because it will take time for everyone else to be vaccinated.
So I think the notion that the vaccine is here does not mean that we stop, practicing the intervention that have been put in place, like social distancing, wearing of masks. Those must continue. Even for those who are going to be vaccinated, by the way, they need to continue wearing masks. They need to continue keeping social distance. They need to continue washing hands. The reason here behind this is that although even if you get the vaccine, currently we don't know how long this vaccine protects an individual. And therefore, from the knowledge that we have at the moment, that for now the vaccine can protect you up to 4 months. So meaning that if you're vaccinated in 4 months, if the protection goes away, you are still at a risk of getting infected. That is number one. Number two, it is also important to know that if I get that jab today, there is a small window of period when your body is making the protection. During that time, you can also get infected with COVID. So we still need to maintain wearing of masks, social distancing, and everything else.
Okay, so Dr. what you're saying is yes, even with the vaccine here, people will still have to observe the protocols and wear their masks for a very long time.
Sure.
Okay. There have been concerns on the vaccine in terms of the effects that it has. Is there any that concerns you? Because I was speaking to a couple of people, they're saying, we are not even sure how safe this is. Are there concerns, genuine concerns?
So for a vaccine to be rolled out to be used in human beings, there's a number of things that people who do research on these vaccines do. And one of the things they do is to look at the safety of that vaccine in humans. Although this vaccine has been tested for a short time, but the safety profile shows that it is fairly safe in humans. But having said that, there are those symptoms that you get when you get vaccinated, and those are normal. For example, when you get the injection, you will get soreness and redness in that area. You may get, mild fever. You may get, joint pain and muscle pain. But this should not last for more than 1 week. Those symptoms should go away, and those symptoms actually occur because you are developing immunity to the vaccine. So the vaccine is fairly safe.
So people have no reason to worry. Tell me, how concerned are you about the new variants that everyone is talking about, with specific respect to Kenya?
So everyone globally is concerned about those new variants of COVID-19, but already we have some data regarding the current vaccines which have been rolled out. Remember, we have the Pfizer vaccine, which has been rolled out for vaccination. We have the Moderna vaccine, which has been rolled out for vaccination. But we have the AstraZeneca, which is actually here, which is coming to Kenya in the next 1 week. There is evidence on, how much these vaccines can protect against those variants. The AstraZeneca vaccine, which is coming to Kenya, has been shown to provide minimum protection to those who get infected. If you are vaccinated with the AstraZeneca vaccine and you get infected with the COVID virus, it can protect you from getting severe COVID disease, which is actually the goal of vaccination. That is what we are trying to avoid. But it doesn't protect you from getting mild to moderate COVID disease.
So basically, even when you get your vaccine, you will still get COVID, but it will not be as intense.
Yes.
Okay, finally, as I let you go, there has been concern about Tanzania. There's very little information coming in from the Tanzanian government on the number of COVID-19 infections. And the concern is now along the Kenyan border with the Tanzanian. From your experience, as a medical person, what are your concerns with respect to the border between Kenya and Tanzania? What should the Kenyan government be doing now?
So, Linda, if you think about what we are doing now with regards to vaccination, our goal is to reduce the number of Kenyans who are infected with COVID-19.
Yeah.
We cannot achieve this goal if, for example, we have countries in our neighborhood which are not actually putting in measures to control COVID-19.
Yeah.
And knowing what we know about Tanzania of last year, they refused to observe any of those interventions, like wearing of masks, social distancing, washing of hands. I think that there has been an intense spread of COVID-19 in Tanzania. But in terms of what can we do as a country to protect ourselves, right? We need to actually put intense surveillance measures at the borders. So everybody who is coming from Tanzania into this country should be tested. And, if they are positive, they should actually be quarantined until they test negative.
Otherwise, everything we have been doing as a country will have been done in futility.
All the gains will be lost, Linda.
Good place to end this conversation. Dr. Julius Oyugi, virologist and microbiologist, thank you so much.